Julie, do you know what this is?
The EVD setup.
What does EVD stands for? Just kidding. So I'm going to go over with the setting up the EVD, the zeroing the EVD, the manual ICP check, changing the bag, and getting samples. So first thing, when they come up from the OR, they come up with this whole thing, the volume control, and you already got attached level. So the only thing that we need is, of course, this is attached to the patient. Yeah. We need the pole, and we also need the cable. So just make sure you got the right cable. And we always want to make sure that our patient is on the 30 degrees, head of the bed elevated. And we always want to zero in the beginning of the shift if they just came from the OR, so we can see what the ICP would be. You always have to make sure that the leveler and the zero is on the tragus of the patient. And the patient's head needs to be in midline. You have any question with that? This one doesn't work, so.
Yeah, a lot of times I feel like the battery doesn't work on those things.
So,
And it only comes with like that plastic part in the bed.
yeah, sometimes, but lately I've been seeing them with this. I guess there was an issue that we couldn't find this, but then Myra found a lot of it down in the ICU, and there's actually 2 extra one that's in the target when you enter. It's hooked up in one of those metal things. And in the pole, you can grab any pole. Anyway, so,
And the leveler?
the lever is already
It's attached to the,
to the balloon, so you don't have to worry about that. But probably, I just want to make sure that it works and there's light and there's battery in it. But I'm pretty sure Matt is good at that, so. Matt. So zeroing, so let's just say that the doctor's order is at 20. And we zero the EVD. So just remember that when we zero the EVD, we zero the EVD every time the patient's coming from the OR or the first time they're gonna come here. Any change of position, or when the patient comes from like MRI or CT scan. So we always have to zero it. And beginning of the shift. And the beginning of the shift, you want to ask also the off-coming nurse, what's your EVD look like? What's your ICP been? What's the color? What has been draining? So those are just a question. And if any doubt that you have any question about the reading of the EVD and the monitor, you can just zero your EVD. So when we're zeroing the EVD, of course, we have it open to the patient for now. Let's just say the doctor's order at 20. We want to zero it to the monitor. You want to make sure that the drain have a CSF, all of it, but if you're not sure, you can start lowering it. And you can see that the CSF is start to drain, like the inside of it. Right on that side. And when it's about to drop, that's when you close it to the patient. And you can continue to put this Voitrol down to 0. Let's lock it there. Press the monitor, like zeroing an art line. You just have to wait for the 0 twice. And then we can go back up to our order of 15. And then you can open it, and you can see what the ICP is.
and we always place it on the water side, correct?
Yes, on the water side. If you really want an accurate reading for your ICP, like every hour we check the ICP reading, you can just close it to the drain and the transducer and the patient, and that will be your ICP. Now, if you want to check your manual ICP, same thing with it. Instead of going down, we're actually going to go up. So if our order is 15, you want to go as high at least at 30. And it's still open to the patient because you want to make sure the CSF is filled. The tubing is filled with CSF. We can start lower, if we only see the CSF in here, we can start lowering it until we see the CSF in the meniscus, which is this arrow. And when you do see that CSF there, lock it. And the mercury will be your ICP. Okay? Does that make sense? Any question? Now, we're just gonna go with changing the bag. So changing the bag will be, you're gonna need 2 RNs. You're gonna need, of course, sterile gloves, 3 betadine, and just make sure that it is locked to the patient, so it was not continuously draining. And we just wanna make sure that we have enough sample in the Voitrol. Sorry, not sample. I'm confusing it, sorry, with changing, but, sorry, changing the bag. So just make sure that it is locked for the patient. So you need 2 RNs, so the first RN will be sterile.
When do you change it?
It's 3/4 on the back. we changed it. And by the way, there have been some issues that we couldn't find the bag. It actually came with this, but this is the whole setup, and we don't do this. They're located in the line part. If you see this, next to it is a box, and this is one bag already. So it's just inside of it and just open it. So you're gonna need 3 betadine to clean it in a sterile glove. So the first RN, they will wash their hands, put the sterile gloves, and then they're just gonna wipe this with betadine, just around in this area. And then she will start to just loosen it, while the other RN is getting ready to be sterile, washing the hand and putting the sterile glove in also the bag. And then you unclip it in here, and then you take it out. And this goes to the red bin. You're just gonna wait for a minute before you put the new bag in. So that's when the second RN who's sterile will come in with a new bag. We'll hook it up, tighten it, and just clip the bag. That's it. Does that have any question?
If I can't get the thing to unloosen, can I use clamps on it?
I would recommend clamps because as you can see, this is flimsy, but I mean, I've had an experience with that. So what I did is while it's still here before I changed the bag, I actually just flushed it with normal saline because it loosened up the glucose. Yeah. So that's just because if you're gonna feel it, it's so flimsy. If you're gonna put a hemostat and you're gonna apply more pressure, it's gonna break. And that means we have to change the whole thing. So that's just my experience. Yeah. Do you have any question?
So while it's drying, you can't just get another pair of sterile gloves and then open up the
bag?
Yeah.
Yeah, because
and
you
then
don't
add
want
it
to keep this
sterilely.
open for that long. It says on the policy it's like 30 minutes, but that's kind of too long to keep this open while you put the new bag. That's why this is a 2-person.
But then you said let it dry for a minute. It doesn't
For a minute,
Yeah,
yeah.
it
The
doesn't
policy
take-
says to ride it for it might take you a long time, especially with those sterile gloves, putting it in. If you're already sweaty, if you're doing this by yourself, it's not safe. Because there's a lot of chances that you can contaminate this. Does that sound like this? Yes. Now, getting some samples. Same thing with the samples, so here we go. Sorry, I confused it earlier. So with the Volutrol, you always want to get if you want to send it for a sample, we ask for a minimum of 5 ml at least. And we use the 10 cc. And if you can find needles that 25 gauge lower than that, then that will be perfect. It is going to take a while, of course, to get the sample, but you don't want any larger needle because you don't want to put a hole on the side. In our practice, we don't take samples in here. We take samples directly to the Volutrol. So of course, you want to make sure that it's off to the patient and it's off to the drain. Same thing again. This is you can do it in one person, but if you need help, go ahead. Because sometimes this bowl can be like 2, it can move a lot. But you can do it also by yourself. So you need the sterile gloves and also the betadine, the 10 cc syringe, and a blue cap that's sterile, and the needle, if we can find 25 gauge rings. So you're gonna drop all of it in your sterile field, wash your hands, put the sterile gloves. So you're gonna do betadine again 3 times, 20 seconds each for about a minute. And then you're gonna put your syringe with a needle, and you're gonna stick it right on this side. And as soon as you're ready to take the sample, what do you call this? Just make sure you quickly put the drain open and put this off on the back so all your CSF is not going to go there and you'll get the sample, and just slowly collect your sample. And then when you collected your sample, that's when your blue cap is going to go to the 10 cc syringe. We don't transfer it to anywhere. You have to put a label on it, on the patient label, and then you have to walk it into the lab. You cannot keep it. There are some instances that we don't have a sample for here and the doctor ordered it, so we usually just ask the doctor, hey, I don't get a sample in here, but there's a CSF in the morning. Can
And
I
then
just
you log
lower
it.
it down to get an enough sample? Some doctor will tell you like, yeah, that's fine. Or they would just tell you that just wait in the morning when the kid is awake, then there's possibly going to be some samples.
And then you log it into the book.
Book in where? At the lab? Yeah, they have you, they double check it, where you just make sure it's the right patient. So, it's the same thing when you drop some other stuff too. So, okay. So lately, there's been an issue with transporting. So we do not transport the patient. As you know, our new monitor can do both. Can do the art line and can also do the ICP. The chances, there's going to be a chance of dislodging it if we're going to transport the patient with the whole pole. So what we do is we just unhook this. There are some transport, it depends on them how they want to transport the patient because this blue thing is not compatible to MRI. But I find it safer to just transfer the patient with the whole system because if you're gonna feel this, it can break easily. And if you just left it on top of the head, it can break easily and you're just gonna have to change the whole thing. So might as well take the whole thing with you. So you just unscrew it, make sure it is locked on the patient and it is off to the drain. And please empty your Volutor before you transfer the patient. Okay? And then you just put this. It's safer also if you wrap it with a blanket, the baby blanket, and just put it on top of the patient's head. Okay? Does have any questions?